What if I told you that some of the tests your doctor is recommending right now could actually make you sicker? Not because your doctor is wrong, not because medicine is bad, but because nobody is telling you what happens after that test comes back with something on it. I'm going to change that today. My name is Dr. Isabel Greer. I've spent over a decade working specifically with patients over 60. I've sat across from thousands of people, held their hands after scary diagnoses, and watched what happens when good intentions lead to bad outcomes. What I'm about to share with you is something I wish every patient over 60 knew before they walked into a screening appointment. By the end of this video, you'll know exactly which 5 tests are most likely to start a chain reaction you didn't ask for, and what smarter options look like. Stay with me because the 5th one surprises almost everyone. Quick note before we start. Everything in this video is for educational purposes only. It is not medical advice, and it does not replace a conversation with your own doctor. Every person is different. What I'm sharing today is meant to help you ask better questions, not skip care entirely. Okay, let's get into it. Here's the first thing you need to understand before we even talk about specific tests. There's a pattern in medicine that nobody warns you about. I call it the snowball. You feel fine, you go in for a scan or a test. The test finds something. Now everyone has to do something about it. One test leads to another. That leads to a procedure. That leads to a complication. And somewhere in the middle of all that, you went from feeling perfectly healthy to being a full-time patient. That's the snowball. And it almost always starts with a single test you never needed. Keep that image in your mind as we go through these 5 tests, because once you see it, you'll spot it everywhere. The first test on my list is one of the most popular ones being sold to people over 60 right now. I'm talking about whole body scans, full body MRIs or CT scans that promise to check everything at once. The ads make it sound perfect. Come in, lie down for 30 minutes, and we'll see everything happening inside your body. Peace of mind guaranteed. I understand why people want this. I really do. The idea of knowing everything feels like control. But here's the reality. When you scan a healthy person over 60, you almost always find something. A small spot on the lung, a cyst in the kidney, a shadow on the liver. Research shows we find something in up to 90 to 95% of people. Not because they're sick, because that's what bodies look like after 60 or 70 years of living. Think of it like this. Imagine someone takes a very detailed photo of your face and zooms in close. They'll find every pore, every tiny mark, every little line. Does that mean your skin is diseased? Of course not. That's just what skin looks like up close. The problem is that when a radiologist writes those findings in a report, the words sound terrifying. Pulmonary nodule, recommend follow-up. Hepatic lesion, further evaluation advised. Suddenly, you're not a healthy person anymore. You're a person with a finding. And from that moment, the snowball starts rolling. More scans, a specialist, a biopsy, a procedure with real risks, infection, bleeding, reactions to anesthesia, months of anxiety. And at the end of all that, usually nothing, usually a finding that was never going to hurt you. Studies have followed people who got these scans. They didn't live longer than people who skipped them, but they did have significantly higher rates of anxiety and unnecessary procedures. So, what's better? Focus on how your body actually works. Can you walk 2 blocks without getting winded? Can you get up from the floor without help? How is your sleep? How is your energy? These things tell us far more about your health than any scan. If you want a real checkup, sit with a doctor who will actually talk to you, not just scan you. Stay with me, because what's coming next affects millions of people, and almost nobody talks about it this way. The second test that worries me is brain MRIs ordered for mild memory complaints. Here's the scenario I see all the time. You're in your 70s, you can't remember where you put your glasses, you walk into the kitchen and forget why you went in. Maybe your kids are scared. They've heard about Alzheimer's and they push you to get a brain scan just to be sure. I get it. Memory loss is one of the biggest fears people over 60 have. It's personal. It touches who you are. But here's what I need you to hear clearly. Getting a brain MRI for normal, everyday forgetfulness is almost never helpful, and it is often harmful. When we scan the brains of healthy people over 75, more than 90% of them have findings that look alarming on the report. Mild cerebral atrophy, white matter changes, small vessel disease. These terms sound like damage, like something is breaking down. But they're describing normal aging. Every brain over 75 looks like this. It's the same as looking at an X-ray of someone's spine at 70 and being shocked that it shows wear and tear. Of course it does. That's a spine that has carried someone through 7 decades of life. The image does not match the reality. I've had patients who were sharp, witty, and fully independent, managing their finances, reading every day, sharp as they ever were, and their MRI looked on paper like a mess. And I've had patients in early cognitive decline whose brain scans looked clean. The picture lies, or at least it doesn't tell the truth we think it does. And once a patient reads those scary words in a report, something changes. They stop trusting themselves. They start watching every little moment of forgetfulness with fear. That fear itself affects memory and mood. The scan didn't protect them, it hurt them. What's better? There are simple, quick tests we can do right in the office. Memory word recall, drawing a clock, simple math. These tests take 10 minutes and actually measure how your brain is functioning, not just how it looks. And here's the good news. Most causes of memory problems in older adults are reversible. Medications that cloud your thinking, low vitamin B12, depression, which very often shows up as memory trouble in older people, sleep apnea, cutting off oxygen to your brain at night, thyroid problems. We check for all of these first. You would be amazed how often fixing just one of them brings someone's memory back completely. Don't let a scary-sounding MRI report tell you a story your brain hasn't written yet. Third on my list, and this one surprises people because it sounds so sensible, routine cardiac stress tests. Specifically, putting someone on a treadmill just because they've reached a certain age, or because they're scheduled for routine surgery. Here's how it usually goes. You're 72. You're going in for a knee replacement or a hernia repair. The hospital requires a cardiac clearance for everyone over 70, so they schedule you for a stress test, even though you feel perfectly fine and walk 2 miles every morning. Now pause and think about that. If you walk 2 miles every morning without chest pain or dizziness, what is the treadmill going to tell us that your daily life hasn't already shown? Your life is your stress test. You're passing it every day. But you get on the treadmill anyway, because that's the protocol. And here's the problem. Stress tests in older adults have a very high rate of false positives. That means the test says something looks wrong when nothing is actually wrong. It could be your heart rate response, your medications, 100 different things that have nothing to do with a dangerous blockage. But once that test comes back with a flag on it, the snowball starts again. Cardiac catheterization, a tube threaded through your artery all the way to your heart. An invasive procedure with real risks. And usually, after all of that, they find what you'd expect in a 72-year-old heart. Some plaque, some narrowing, nothing that needs surgery, nothing that was about to cause a heart attack. But now you've been labeled. You're a heart patient, new medications, restrictions, and maybe, just maybe, you were playing tennis before all this started, but now you're afraid to push yourself. The test that was supposed to protect you has stolen your confidence. What's smarter? Listen to your body first. Chest pain with exertion, unusual shortness of breath, feeling dizzy when you exercise, those are signs that something needs attention. Go get checked. But if you want to know your future risk without the treadmill drama, ask about a coronary calcium score. It's a quick, low-radiation CT scan. Takes 5 minutes, no needles, no running. It gives you a number that shows how much buildup is in your arteries. That number guides prevention. It doesn't automatically send you down the road of procedures. It gives you information, not anxiety. We've got 2 more to go. Don't stop now. Number 5 is one that catches people completely off guard. 4. Colonoscopies after age 75. I want to be careful here because this one needs context. Colonoscopies are excellent. I recommend them. If you're in your 50s or 60s and you haven't had one, please go get it done. They save lives by finding and removing polyps before they become cancer. But at a certain age, the balance shifts. Here's the math. A colonoscopy prevents cancer that takes 5 to 10 years to develop into a real problem. If you're 79 or 80 with no prior polyps and no family history of colon cancer, you have to ask, is the benefit of preventing a cancer you might never live to see worth the real risks of the procedure itself? Because those risks go up with age. The bowel prep, that awful overnight cleanse, can leave an older person dangerously dehydrated. The sedation carries more risk of confusion and breathing issues in older adults. And the most serious risk, perforation. The wall of the colon gets thinner as we age. The risk of the scope accidentally tearing through it roughly doubles or triples after age 75. A perforation is a surgical emergency. For an 80-year-old, emergency abdominal surgery can mean the end of independent living. That's not a scare tactic. That's the actual risk-benefit calculation. Most major medical guidelines now recommend stopping routine screening somewhere between 75 and 85 for people with no special risk factors. So what do you do instead? You don't ignore your colon. You watch it differently. Pay attention to symptoms, persistent changes in your bowel habits, blood in your stool, unexplained weight loss or abdominal pain, new anemia. Those are red flags at any age. They mean you need a colonoscopy, full stop, and feed your colon well. Fiber is the single most powerful tool you have. fruits, vegetables, beans, whole grains. Fiber feeds the good bacteria that protect against inflammation and cancer. It costs nothing and helps everything. Get the colonoscopies when they make sense. After your mid-70s, for most people, shift from invasive screening to smart, symptom-aware eating and watching. And here's the fifth one. This is the one that surprises people the most. Carotid artery ultrasound screening. Scanning the arteries in your neck to look for blockages, often offered at health fairs, community screening events, or as part of a heart health package. Sounds reasonable, right? Check the pipes leading to your brain, catch a stroke before it happens. But here's what the research actually shows. When you screen people who have no symptoms, no mini strokes, no sudden weakness, no vision changes, no speech problems, you find narrowing in the carotid arteries in a significant percentage of older adults. And most of those people will never have a stroke from it. The narrowing, called stenosis, sounds alarming. And once it's found, the pressure to do something is intense. That something is often a carotid endarterectomy or stenting, surgery on the artery in your neck. And here's the number that every person over 60 should know. For people with no symptoms, the risk of having a stroke or dying from the surgery itself is roughly equal to, or higher than, the benefit of having the surgery done. You can go in for a procedure designed to prevent a stroke and have a stroke because of the procedure. That's not theoretical. That's what the data shows. The U.S. Preventive Services Task Force actually recommends against routine carotid artery screening in people who have no symptoms. Not because strokes don't matter, because the intervention doesn't help and often hurts. What does help? The same things that protect your heart, protect your brain. Managing blood pressure consistently, not smoking, staying active, keeping blood sugar under control if you have diabetes. These aren't exciting, they don't come with a certificate or a printout, but they are what actually reduces your stroke risk. If you have symptoms, sudden numbness on one side, a brief episode of confusion, vision changes, slurred speech, that is a medical emergency. Call for help immediately. You need evaluation right away. But a scan at a health fair because you're over 65? That's a snowball waiting to start rolling. Let me bring it home quickly. 5 tests that are more likely to hurt than help after age 60. Whole body scans that find things that were never going to harm you. Brain MRIs for normal forgetfulness that make healthy people feel broken. Routine treadmill stress tests that trigger a cascade of invasive procedures. Colonoscopies after 75, where the risks start to outweigh the benefits for most people. And carotid artery screening in people with no symptoms, where the surgery meant to prevent a stroke can cause one. The thread running through all 5? The snowball. One finding leads to another test, to another procedure, to a complication. And at the end of it all, you're worse off than when you started. Health is not about having perfect numbers on a report. Health is about function, about doing what matters to you, walking, laughing, cooking dinner, hugging your grandchildren, reading, traveling, living. The goal after 60 isn't to collect more tests. It's to protect the life you're already living. The smartest thing you can do is be an informed patient. When a test is recommended, ask 3 questions. Why do I need this test? What happens if it finds something? And is there a simpler, safer alternative? You are in charge, not the protocol, not the reminder on a computer screen. You. If this helped you think differently about your health, subscribe. I put out honest, practical health information for people over 60 every single week, and I'd love to have you here for the next one.